Welcome to the Weathering Change seminar. I would like to introduce our speaker today, Amy Padula, from the University of California, San Francisco, and I'll turn it over to her now.
Thanks so much for inviting me to talk today. So I will share some of our work that we've done over the past 5 years on wildfire smoke exposure during pregnancy and impacts on perinatal health. I am the interim director of the program on reproductive health and the environment here at UCSF in the Department of OBGYN, also with the joint appointment in epibiostat. So I just wanted to start by just kind of including this figure that we had included in a review paper several years ago of how we're sort of thinking about environmental exposures in the context of individual and structural social stressors. And I think disasters, including wildfires, really come with a lot of considerations about people's kind of vulnerability, both on an individual level and on a neighborhood level. And then that on top of these environmental exposures can really be kind of quantified on both levels to be combined to look at health effects, and in this case, perinatal and child health effects. But I think sometimes if we just look at the environmental exposures without this context in mind, we can kind of forget some of the kind of additional considerations that can either make some people or some communities more resilient or more at risk. So, just to throw out a few of the ideas we'll be talking about today, of course, with wildfires, on top of the kind of air pollution and the smoke that we'll be studying, we've also considered things like housing factors that also may contribute to the infiltration of that smoke into the home, or people's levels of neighborhood deprivation or socioeconomic status that can also put people at a higher risk. And we have a lot of examples of this, but it's also good to think about, who's spending time outside, who needs to be outside, maybe because of their work, or also just kind of are spending it outside just as part of daily life, even among all these wildfire events. And just to also introduce, so this is a map of California, but this is really not although the data that I'll be presenting is all from California. I think, and that we started this over 5 years ago, I think in that time, it's been really clear that this extends far beyond California, not just our own smoke, but really this wildfires are popping up all over the country and all over the world. And they are becoming larger, more intense, more destructive, and more deadly. I can say for California forests, they're quite crowded at the moment. And although they're adapted to burn at regular intervals, they're not adapted to burn at this kind of intensity. On top, and owing to climate change, we not only have higher temperatures, but this is also causing real changes in wind patterns and wind strength that is also extending these wildfires to more places. We're having more lightning events, which are igniting these fires. And then we're also having, prolonged droughts in California and much of the western United States that is really making these wildfire events more common. And then on top of that, we also have more people living at the wildland-urban interface, which is also we call the WUI. And so this is the area, this is really on the kind of border between, forest land and where people, and more urban and suburban living and towns. So, and this is partly due to just to the increased population in California, but also that people want to be close to nature. And people are moving more to this area also because of affordability. So the coast is extremely expensive in California and people are moving more inland, but then also in many cases closer to smoke exposures. So between all of these factors, more people are getting exposed than ever before. Okay. So this is a little bit outdated, but I think this really does speak to these are the top 20 largest California fires, kind of shown in this pie chart through history and kind of how big they are. And you can see, in the past, probably due to a lot of logging in the, 30s through the 90s, there and also just lower temperatures. There weren't that many forest fires or really large ones. And then it started picking up through the 2000s, 2010s, and then come 2020, we've really started seeing really these massive fires that have been absolutely devastating. And this doesn't even include, 2025, which of course had the LA fires and some of the more recent ones. But I started studying them right here around this 2017, 2018 when things started getting really big in California, but it's continued to skyrocket. So I study pregnant people, and one of besides being in the Department of Obstetrics, Gynecology, and Reproductive Sciences, I've always been interested in studying pregnant people because of this, critical period of growth and development for the fetus, but also because of this really interesting physiological changes that occur during pregnancy. However, this does make them more susceptible to air pollution because of the increased inhalation rate. So, and then also the increased cardiac output, that these physiological changes are making pregnant people more susceptible to air pollution. And then on top of this, the really kind of critical growth and development of the fetus makes for a susceptible time on both sides. So in the past, I had really focused on traffic-related air pollution as it used to be the kind of dominant source of air pollution in California. People love their cars. And and for a while also, even as cars were getting, better gas mileage and more electric cars, we also were just driving more and had more cars. So, although the improvements were made, thanks to the Clean Air Act, that still remained quite a large source for a long time until recently, when wildfires now are at least 50%, if not more, of the PM 2.5, these fine particulate matter in the air in California. So I think PM 2.5 used to not be a kind of language that everybody was familiar with, but I think these days people generally know that these are the fine particles. They generally are measured at PM 10 and PM 2.5, but the smaller ones, the PM 2.5, really can get ingested and get into the bloodstream and into organs, and can really wreak havoc on all types of health outcomes. It's well known as established with, cardiovascular disease and respiratory disease. And I've always just been interested in relation to birth outcomes. So, as part of an R01 about 5 years ago, we started a study on wildfire, smoke, and preterm birth using the CMAQ model, which is a Community Multi-Scale Air Quality Modeling System from the EPA. That is a chemical transport model that used emissions data and meteorology to estimate how much of the PM 2.5 could be sourced to fire. And this is largely wildfires, although it does include prescribed burning and other types of burning. And we linked this model at the geocoded, so we use the geocoded residence from the birth records of over 5 million births in California from 2007 through 2018 to examine risk of preterm birth. So we had looked at, air pollution, PM 2.5 and carbon monoxide and nitrogen dioxides in the past and had found associations. But we were curious whether the associations of fire sourced PM 2.5 specifically would be how that might compare and whether that was potentially more toxic. So this just gives a glimpse of what the state looked like during 4 weeks of 2018. I was actually pregnant during this time and writing this grant that on wildfire smoke and preterm birth, but there was nowhere in the state that you could go to get away from the smoke. It was really, and this was for, each panel is a consecutive week in 2018, and I really thought I had cursed myself. But this was, this was multiple fires across the state, and every corner of California was covered for a solid month. So here are some results from that from the original study of this wildfire and preterm birth. And we looked at it a few different ways. So first we looked at the entire pregnancy and just did a kind of really simple analysis of, if we were to increase, just with a logistic regression of a 10 microgram per cubic meter increase in PM 2. Of this fire PM 2.5, what would the risk or odds of preterm birth be? And so we found this, 13% increase, and this is very coherent with what we had found in our studies of total PM. So it really didn't seem, much different. We also looked at it by trimester, which we often do in these types of studies. And in previous studies, we had found the second trimester to be more strongly associated with preterm birth, but in this case, they all looked quite similar. But I was still kind of curious about whether there was a critical period of exposure, because preterm birth is one of those outcomes that we just really don't know still much about, and the risk factors that we do know, don't explain very much of it, and it is a very heterogeneous outcome. So it's likely that there are several different factors kind of impacting this timing of parturition. So I was convinced that there must be a critical period, whether, sometime during pregnancy. So we looked at every week of pregnancy, which got a little exhaustive with 5 million births, but we did it. But I was really kind of astounded that there really didn't seem to be a critical period of exposure. So this is now looking at each week, just a single week of pregnancy exposure in relation to that eventual preterm birth. And so really this showed us that it doesn't really matter when you're exposed, like everyone is at risk pretty much for the entire pregnancy. And even though it kind of dips up at the top and it looks like it's a slightly higher risk, when we did some more sensitivity analyses, that pretty much went away, and it really just stayed kind of elevated but small. This kind of steady risk. So much for my hypothesis. But one additional study that we did kind of on top of this was led by my former postdoc, Rachel Sklar, who's now at the University of Washington. And she was really interested in housing factors and how that might impact who is affected by wildfire smoke and who is potentially safer from it. And she thought, well, because this could have really big impacts. And also in California, the housing stock really varies between the coasts and the inland, just because of the differences in temperature, rain, kind of variability, and then also, by socioeconomic status and size and so forth. So previous studies had looked at infiltration of outdoor air and kind of this air tightness. And older homes tend to be leakier, smaller homes tend to be leakier, and then those with crawl space, as opposed to a slab foundation, tend to be leakier. So she used data from the tax assessor, which are generally used to kind of populate, Zillow and Redfin and all of these sites about housing, for sales and rentals. So she used those data to and matched them to our birth records to see if people who lived in leakier homes may have a stronger association between the wildfire smoke and preterm birth. And so for this study, instead of using the CMAC data, we also used one of these other exposures, which is from NOAA's hazard mapping system that are called smoke days. And these are made from satellite maps of plumes that show kind of how dense the smoke is over different areas, and they get kind of graded by these 3 levels, and then kind of cover this space. I think the one limitation is that this is a very high level, so it doesn't show how close to the ground the smoke is. So that could, of course, impact someone's true exposure. But in our studies, we used both and found very similar results, and very, very consistent. But getting back to Rachel's work, so she used, looking at all those other factors, she didn't really find much of a difference between the associations between wildfire smoke and preterm birth as they differed by all those other factors. But one thing she found was that swamp coolers, or they're called evaporative coolers, homes with these showed an increased risk of preterm birth attributable to wildfire smoke. And this is pretty interesting because these are used more frequently in these, in the Central Valley, these kind of highlighted counties, and also areas where there's generally higher air pollution levels, and even in many cases more preterm birth. But the thing about these cooling systems, I'm not sure if you're familiar with these in Ohio, but they take outdoor air and they bring it through, over this kind of cold water, and then it cools the air, and the outdoor air just comes in without any types of filtration, as opposed to like an HVAC system that includes a filter as it pumps air through the home. And so this creates a kind of an issue of whether people, when it's hot and there's a wildfire, do you put this on and bring in the outside smoke, at least with cooler air, or do you, keep it off and close the doors and windows and suffer in the heat? So, but anyway, these coolers were associated with a stronger impact on preterm birth. And there's actually been other studies that have now attached filters to these as kind of like a makeshift adaptation to be able to improve people's, cooling and filtration systems in these in these times of heat and smoke. And I think this also has, implications for other kind of weatherization programs, especially in low-income housing. There's also been talk, at least in Los Angeles, about mandating air conditioning units really for kind of extreme heat issues. But of course, then this also brings up the issue of air pollution and wildfire smoke. But I think that there's certainly policy directions to protect people living in vulnerable homes. I'm now going to shift a little bit into some of the work that we've done. This is actually also in California, but this was to look at other kind of characterizations of wildfire smoke, because once we had sort of established this idea of that more wildfire smoke was associated with more preterm birth, I had more questions. And also once we had found that there was no real critical period, I thought, well, I still have questions. Is it, worse if there's a day that's extremely high, just 1 or 2 days, or is it worse to have kind of a medium day, but that goes on for a week? Or, is it really the duration? Is it the intensity? Is it the frequency? So we still had more questions about, what makes wildfire smoke more harmful, or kind of what situations that we would want to look out for to be able to tell clinicians or tell patients, or just protect public health in general. So this work was led by Joan Casey, also to look at the distribution of wildfire smoke in California. And found that Native Americans were much more highly exposed due to their locations in California were really close to a lot of the fires during this time. So this became also another question of, environmental justice, or, a vulnerable population that we also want to consider. This group is also, because of the sort of small numbers, is often lumped in with kind of other or left out of studies that are stratified by race, ethnicity. So this is something we wanted to pay attention to. But this was also a paper really focused on how to characterize wildfire exposure over kind of a longer period of time. So we came up with these kind of metrics that consider how high the levels of smoke were, how long they lasted, and how frequently people were exposed to them. So this, we just kind of came up with some of these, and then we applied them to our study of preterm birth and went back to see is there the number of smoke wave days. Sorry, I should start with a smoke wave. So we first defined the smoke wave as 2 or more days over a threshold. In this paper, we use both 5 and 20 to see if just to kind of gauge different intensities. And then we also looked at it kind of again across these quartiles. But when the number of smoke wave days was 1 to 4 during a pregnancy, there wasn't much of an association with preterm birth. But then as you increase to 5 to 8 days, we got up to a hazard ratio of 1.01, and then over 9 days or even 15 days, it increased even more to a hazard ratio of 1.04. So we saw this increased risk with the increased number of consecutive smoke wave days. And then we also looked at the actual concentrations of PM2.5 during those days to see if this kind of idea of intensity, as that increased, whether we could kind of capture that as with increased risk. And indeed, again, these are really small increments, but they're also quite precise, but they do increase. So the higher the levels of the concentrations, the stronger the association with preterm birth. So we looked at both of the averages, and then here are the maximum daily averages. And so this is also really kind of getting at that idea of the kind of intensity, and really showed this kind of remarkable exposure response across quartiles of exposure. And then again, looked at the cumulative daily PM 2.5 of during the smokeways across the pregnancy. We got up to some really high numbers. There are some people who are quite exposed cumulatively and showed increased risk of preterm birth. So this was just another way. I was thinking, oh, maybe we'd find kind of one aspect of it that's worse. Really, they're all bad, but in their, more is worse. But we were at least able to sort of tease out a little, or just understand a little bit more of this idea of frequency, duration, and intensity contributing to exposure. Allison Sherris, who's also at the University of Washington, led a study in ECHO, the Environmental Influences on Child Health Outcomes, which is a consortium of pregnancy cohorts across the United States, and to look at wildfire smoke in relation to preterm birth. And so this shows, this is a map of sort of where all of the participants are located and the number of smoke days, kind of ranging from yellow to this dark purple. Actually, there's quite a few in the Midwest and sort of these really dark exposures. But we did find an association, but it was really actually driven by the states in the West, despite the pretty ubiquitous exposures across the country. So just to orient you to these figures, so the top panel, this A, the top three figures across the top are the entire United States, and then the bottom three are just the Western United States. So all of the estimates between wildfire smoke and preterm birth did kind of cross this null line of in the United States. And then in the Western United States, we did see an increase in preterm birth risk associated with the wildfire PM 2.5, and also showed this, exposure response as well. So the first panel is just showing, this middle panel is showing the concentration increase. So of any wildfire smoke of it over 2.5, over 5, and over 10. And this is really just the wildfire specific concentrations. The total, of course, is always going to be more than that on top of, everyone's usual air pollution exposures. And then the same thing on the panel on the right with increased concentration and the increase per additional smoke day. The more waves, we got more. So the orange is 2 days, the purple is 3 days, and then blue is 4 days. So we also saw an increase there as well. So more smoke is worse, no matter which way you look at it. And, for this study, although, it was great that we had, representation across the whole country, but on the flip side, compared to our study in California, it's a select group of people in these pregnancy cohorts, so the power was a lot smaller. But I think, as we look in more states and more places, I think we, with a little bit more, with higher numbers, I think we will find more robust estimates. So at UCSF, we conducted a pilot study to really look at some of the sort of biological impacts of wildfire smoke during pregnancy in people who were coming into UCSF to deliver during these wildfire events. So we collected, so we recruited 56 participants. We also asked them surveys about their behaviors and, what they did during these events, and, were they nervous? Did they feel sick? Things like that. We also collected biospecimens. We have banked maternal serum, cord blood, and even placental biopsies to be able to try to understand more about the impacts of wildfire smoke. And then we also did a retrospective cohort just looking at our medical record, going back the last, we did this right around the time of COVID, and we didn't want it to get complicated by COVID. So we kind of stopped there and looked backwards at the few fires that had happened just beforehand to see if it impacted birth weight. So I'll show these brief results from this study. So we haven't published this yet, but we just really were trying to get an idea of what people were doing, and kind of, this is a little pie chart of at what level of the air quality index did they really change their behavior and start staying inside and closing the windows and kind of being careful. And so, usually we would recommend that people do it during this time where it's in the kind of orange or unhealthy for sensitive groups. And a third did that. A third did it kind of when it was one step higher, when it's in the red, when it's unhealthy for everybody. And another kind of big chunk did it kind of when it hit yellow, which is kind of more in the moderate. And these days, I think, happen more often than people realize with the air quality in this kind of moderate range. But I think when there's smoke outside, maybe people are a little bit more apt to change their activity. Almost half wore N95 masks, which was really interesting that people, I think, just had them around because of COVID, which was I guess one silver lining. And then a good portion of people in San Francisco had these air filtration systems, either in their home or their office, which I think was also quite high and reflects probably the maybe the high socioeconomic status of the population here. And then also there were some reports of different symptoms that we captured. But this was kind of used to, as we are kind of planning larger studies, to understand kind of variations in people's behavior. Excuse me. For our retrospective cohort, this was led by a medical student, and she performed this analysis on to look at wildfire smoke in relation to birth weight, and was really surprised that we were expecting to find lower birth weight, which is what we find with smoking and with air pollution. That air pollution is associated with lower birth weight, but we had found higher birth weight. We checked the code a lot of times because we thought, oh, this couldn't be right, but we found this kind of increased risk for gestational age, especially with exposure in the second trimester. And to be honest, when we first saw this, we thought, oh, well, UCSF is a little different. It's probably not representative of anywhere. And thought, oh, well, maybe people are even extra careful here. And really, they had bigger babies because they stayed even more safe during these times. But really, we still published our findings, but we thought, oh, we really were unsure of what this all meant. But then we looked in the rest of California, similar to how we had done it with preterm birth. We looked, and in this case also, we looked at low birth weight, small and large for gestational age, and we also looked at it continuously with Z-scores and just in grams. And we found a very similar outcome. So higher birth weight was associated, higher Z-scores, higher odds for large for gestational age were associated with wildfire PM 2.5. So this is still very curious because it's not just a UCSF problem as we had originally thought. That this is we did find yeah, so, and then also on the flip side, lower low birth weight, lower odds of small for gestational age. So bigger babies with wildfire smoke. And now in this, as we kind of continue to explore this more, we are now looking at gestational diabetes and as a potential kind of outcome that may be on the pathway to higher birth weight. And we're also looking at hypertension at the same time, kind of on the pathway to preterm birth. But those are still in process. And Singao, who's at UC Merced now, it also was really interested in how it may differ by race ethnicity. So she had stratified the analyses and had found that white and Hispanic, or sorry, Hispanic and other race, other of course being this, you know, a really large mix of racial ethnic groups that we unfortunately have lumped together that were at higher risk of birth weight with respect to wildfire smoke. And it was lower for Native Americans, American Indians, and Native Alaskans. So this was also interesting to us since they had the higher exposure in this population, but the lower risk. But I think another, I think this was kind of an initial look at race ethnicity, and Rachel Sklar was also interested in really disaggregating the racial and ethnic groups even further, which are available in the birth record. And with almost 5 million births, you really can start looking into smaller groups. So she started disaggregating Asian and even Hispanic and maybe and other as well, to be able to identify group populations that may be more at risk. See. One other outcome we were really interested in and received a supplement to examine is severe maternal morbidity. So this has been increasing in over the last few decades. So this kind of severe maternal morbidity and also maternal death. This is a kind of a designation that is given to a series of outcomes that are listed here. This is kind of an index. So a lot of these are kind of cardiac events that occur either during pregnancy, birth, or postpartum, and it includes these 21 indicators. But as you can see, this really increases over time, mostly due to blood transfusion. So we often will, that the blood transfusion becomes one of the kind of markers of severe maternal morbidity. So if that's needed, then this is kind of hits this severity level. But because this is being used so much more often, hopefully with, to increase better outcomes, we also look at it sometimes without these blood transfusions as a way to kind of capture outcomes without this other designation. But in general, these pregnancy-related conditions do put the fetus at risk and the mother's health at risk. And we were interested in this kind of really extreme outcome if, for example, if it was associated with this kind of very extreme level of air pollution. And this is actually in press at Science of the Total Environment. And we did find that exposure to wildfire smoke was associated with increased risk of severe maternal morbidity. This is also done in all of California with almost 5 million births. This is a thankfully rare outcome, so only 1.5% 5% of pregnancies experience this, but we were concerned because it is associated with such adverse outcomes. But we did find these, especially during across the entire pregnancy, wildfire smoke was associated with increased risk. We also, I just included all these different kind of models. There wasn't so much of a change when you adjust for all these things like age, education, insurance, smoking, parity, and BMI. Just kind of remarkable that none of those change the model. And then when we did it by year, it did attenuate it a little bit, of course, because of that increase across time, both of wildfire smoke and of severe maternal morbidity. And then we also stratified these results by race, ethnicity, and found that the strongest association was really among Asian and Pacific Islanders compared to the other races, although, and I guess also among Black to a certain extent mothers, and these are the most highly at risk of maternal morbidity and mortality in California and the US for that matter. So just wanted to identify them as vulnerable subpopulations. Just trying to keep an eye on the time. I think I'll feel like I'm getting towards the end, but I'll speed up a little bit. So we recently published our work on wildfire smoke and birth defects in the Central Valley of California. We looked at quite a few birth defects and found an association with spina bifida. This graph is probably too small to see, but there's really just kind of, and spina bifida was really the only one with a statistically significant association with wildfire smoke, although there were a few others that had a little bit of a trend, some heart defects in relation to wildfire smoke. And then we're currently working on wildfire smoke in relation to IVF outcomes. I don't have results here to share, but we are looking at over 10 years of data at UCSF. And so far we've found wildfire smoke associated with lower semen quality, and we'll look at the more kind of complicated but really interesting kind of IVF outcomes in months to come. And this also provides a really kind of unique examination of the critical periods and really seeing the outcomes, because, you know, as opposed to most pregnancies where we're kind of guessing a little bit at the dates here and there, these we know very precisely and can really pinpoint specific outcomes, losses, and impacts of wildfire smoke down to the day. And a lot of our, you know, future plans, or at least hopes and dreams, if studies get funded, would be to compare. Actually, currently we're comparing wildfire smoke to prescribed burns to see kind of this potential policy impact, because, you know, prescribed burns also put smoke in the air, but hopefully not at the same intensities. Also comparing wildland fires to these WUI fires that burn more structures and, you know, a lot more stuff, as we saw in the LA fires. We also want to model home infiltration interventions to see if this is a viable mitigation intervention, and see if we could really reduce indoor levels of smoke, even in these leaky houses in California. And then as part of our Center for Climate, I guess, sorry, I've got so many acronyms here, but the Center for Climate Health and Equity has started this EcoHealth, which is RP20 Center, and as part of that, we're looking at wildfire smoke in combination with extreme heat on some of these birth outcomes, but also respiratory and cardiovascular outcomes. So these are underway. And we also will simulate potential behaviors, change and interventions to see that impact on a population level, and then also work with the community to identify interventions and changes that they would be interested in implementing as well. And just to share our website at the Program on Reproductive Health and the Environment, we have, we'll be adding more soon, but we do have a little section on wildfires if people are interested. And yeah, this is just a little infographic on pregnancy and climate change, and just to have it in people's mind as another thing we need to look out for and understand better. I just want to thank my team at PRE and all of our collaborators, which is growing every day. And yeah, and here's some of our social media that you can follow if you're interested to join our mailing list. So I'm happy to answer any questions.
Well, thank you. What a great talk. It's pretty amazing, the diversity of research and extensiveness of it. Does anyone have any questions?
I do. This is Ardith Morrow. Amy, thank you so much for a great talk. I'm trying to get my camera on, but I'm slow here. Here it is. Yay. So I'm an epidemiologist and co-director of the P20 here. And I've met some of your P20 colleagues. Were you at the?
I was not at the meeting, but I did hear.
I didn't think so. Yeah.
Yeah.
It was a great group that you have. They're doing great work, and this is beautiful work in particular. Since I'm an epidemiologist, I just want to kind of drill down some methodologic things for a moment. First of all, there's a huge amount of information and really very important. And clearly, you know, you're speaking to people here in Ohio. I think all of us that we get periodic wildfire because it's mostly coming from Canada, or, you know, as it gets bad enough, maybe all air pollution is just sort of to the global soup that we all breathe. But when you're looking at these different stages of pregnancy and just the methodology, and obviously, you know, you're talking about a chronically exposed, and you mentioned that, but it obviously is seasonal also. Mm-hmm. I was trying to follow, and it wasn't quick enough, I think, to understand how you are doing the time. So you've got windows of exposure. Is that how you're looking at exposure in the first trimester and the outcome in the first trimester, or second trimester, third trimester? And if you're doing the whole pregnancy, is it it can't be an ever exposed. So I was just kind of confused about how I just missed that.
Sure. Yeah, no, I think we also did it like a few different ways. So I also feel like I apologize if I kind of breezed through that all too fast. But so when we were looking at the shorter time periods, whether they were trimesters or even the weeks, it was to an eventual preterm birth. So it was just looking at that one exposure period, kind of without considering it. In other ones, we considered it kind of cumulatively. So that was like the average over the entire pregnancy, or the number of smokeways over the pregnancy, or other metrics like that. But when I was really convinced that there was a critical period, I was like, no, I just want to look at each time specifically in relation. And we had enough power that I felt like we could, if there were one, we would find it, right? So, because we couldn't have done this in other smaller studies. And so that's why we were really kind of honing in on these, like, what if something happens in the first trimester that then leads to an eventual preterm birth, right? What does it have something to do with, you know, the placentation or something like that? I was really trying to capture something that was not there, at least not that I can identify.
It was logical. It was a logical hypothesis. We only start with what we can imagine, right? That makes sense. It was sensible. Yeah. So I get it now. So the exposure was to the specific window of pregnancy, the outcome was anything that occurred during pregnancy.
Yeah.
Okay, thank you
And
for
we
that.
also, we analyzed it too, you know, for example, using Cox models. So you're only comparing to those that are still at risk. So then
Right.
once they are born, then they're removed from the risk set. So then we also didn't have that issue that you often run into when you're looking at like third trimester and people have different lengths and things like that.
So doing more epi speak here, you're reporting odds ratios. So from a Cox model, it would be relative risk. Did you see any real difference in your point estimates based on which approach you were using?
We didn't. So we did this so many different ways. So originally we had wanted to do the Cox models. We had, you know, hazard ratios, and then found that it was a lot easier to run doing kind of individual logistic regression. So we did it and we tested it. We ended up doing it every which way by the end of the day. And so that's why sometimes I was reporting hazard ratios and sometimes odds ratios, but in the end they were all so comparable. Yeah. Which you'd expect, but it was
that's
still.
what I was noted. I was keeping an eye to, but they did seem, and then that's comforting, I guess. That's
right.
or the bad news is, and it's not very. It's not a huge effect, but it's obviously an important effect because everybody's exposed, right, to levels. So that's the other. Just rehearse and beautiful at the same time, meaning, you know, so you've got something that's going on in nature, if you will, and so it can occur at any time. And there are certain windows where it's going to occur more often. And so when you were thinking about exposure, it wasn't just yes, no, it wasn't binary. Right. You were getting concentrations within a window of time for the whole window, for a week before the event. I mean, how are you?
So usually we were working with a week. So except for the smoke waves where we got a little bit down to the day. But well, actually, yeah. So when we were using the concentrations of wildfire, of continuous wildfire PM 2.5, that we averaged over a week. When we were doing, then we also, for the smoke wave, more recent smoke waves paper, then we were creating these metrics, like the number of times you were over a certain threshold. And then we also calculated the concentrations in those during those smoke waves. So we were trying to calculate it a lot of different ways to see if we could, you know, if one felt more meaningful than others, depending on what you were interested in. And really just to explore this, because this is really kind of hadn't been done. You know, this isn't the usual air pollution epidemiology where, you know, it's a lot more consistent, right? This is very sporadic. So.
And were you using GI as part of this, like their location, right, as part of their exposure?
Yes. So their, yeah, we had their maternal residence geocoded at birth. So of course, there's some issues with potentially moving during pregnancy, but in our kind of sub studies of that happening, it generally doesn't, people generally don't move so far, or that was a small minority.
Thank you for that. There's enough from me. I'm just curious, and it's a beautiful epidemiology and really tough to do, I think, and enjoyed hearing about it.
Oh, thanks so much. Yeah, it's an interesting area. I feel like there's always more to look at or different ways to look at it. So sorry if I glossed or I kind of sped over too much, but there's so many different outcomes I also wanted to share.
No, great. Not all of us are epi geeks. There are a lot of different disciplines here, so I appreciate that.
Great. Anyone else? Well, thank you very much. Oh, go ahead.
Sorry, I actually did have one question. Hi, my name's Alpha. I'm a first year MPH student. I just had a question about this. I think it's slide 25 when you talk about severe pregnancy related morbidity.
Yes.
So when you're doing that analysis, are you stratifying for the fact that maybe, some of the birth defects, or maybe like the preterm birth is going to play into the fact that you are experiencing any severe pregnancy related morbidity?
Yeah, that's a good question. So in this case, the people who the outcome wasn't preterm birth, but really just having a case that was that was one of these 21 events occur in relation to the wildfire smoke. In many of these cases, these would also be preterm births. So it is a very kind of complementary outcome. I would say that there are more preterm births than were listed here. So we were really taking this, but in many cases, I would say this is almost a subset of likely preterm births. But these have like a very, a more consequential outcome for the mother.
Right. Okay. Yeah, that makes sense.
Yeah, so we kind of thought of it as really this kind of extreme subset of this adverse kind of maternal fetal outcome.
Okay. Thank you.
Okay, well, thank you. I think
Thank
it's,
you very much.
I'm,
Thank
yeah,
you.
very
Thanks
much
for the
appreciated.
invitation.
Good education.
Yep.
Bye.
Thank you.
All right, take care. Bye-bye.
Bye-bye.